The Liberal Democrats conference in Brighton continues today, where the theme of the day will be health and social care.
And the party's leader, Sir Ed Davey, joins us now on the programme. Good morning to you, Sir Ed. Thank you for joining us. So we've got Labour with a massive majority. We've got 4 or 5 years till the next general election. How much influence can you as Liberal Democrats really have?
I think quite a lot of influence, actually. We got our best ever result, and now the largest third party for over 100 years with 72 MPs. And each of those are going to represent their communities, be real local champions, particularly on health and care and things like sewage and natural environment, those sorts of things. So they'll be influential for their constituents because they were going to work really hard. And then together, 72 MPs are going to have our voice heard. We're going to get more Prime Minister's questions, more select committee presence, more ability to hold the government to account, which we will do. But we want to be a better opposition than the Conservatives. I'm afraid they've already gone back into yaboo politics. We want a more constructive way to oppose the government, scrutinise the government, and we're willing to support them where we agree, where the government's acting in the national interest. But where we disagree, we will be that better opposition. So, for example, winter fuel payments, we're opposing that, like the Conservatives, but we're opposing that recognising that this is financial mess created by the Conservatives and putting forward alternative ways of clearing up that mess so we don't have to leave millions of struggling pensioners without that support this winter.
OK, so what about another policy area, health and social care, which is going to be the subject of debates there at your conference today? You made that very much a focus of your campaign during the general election only a few weeks ago. What do you make of what Labour are saying, that the Davey report last week and the Prime Minister saying there has to be enormous reform of the NHS, not just putting more money in? Agree with that?
Yeah, well, we do. We haven't seen the details of their reform, of course, yet, John. We have our own reform ideas, and particularly on social care. And I really want to make sure they do sort out the care situation, because for far too long, too many governments over decades have pigeonholed the NHS over here, not realising that if you sort out care, it's a massive benefit for the NHS and is the reform that the NHS needs. So we're up for reform. We just need the right reforms. Another thing we want to do, which we talked about in the general election, is making sure that people have that healthcare in their community, nearer to them, so they can get quicker healthcare. So that means more GPs, more NHS dentists, supporting community pharmacies on our high street. Because if people can get that healthcare, they don't end up going to A&E instead. They don't go to hospital so much. And when they come out of hospital, they can get the care in the community and don't go back to hospital. So, our proposals for investing in primary care and social care would both tackle some of these problems that were left by the Conservatives, but also really reform the NHS for the long term.
From what the Prime Minister and Wes Streeting, the new Health Secretary, was saying last week, though, about these reforms, they were very much suggesting that it's NHS first and social care maybe in the years to come. Are you suggesting you can't really do that the two have to be done at the same time now?
I am suggesting that, absolutely. I don't think we can wait. I mean, we have a package of ideas. First of all, making sure care workers get a higher minimum wage. If you look at one of the problems, the big problems in social care, is there's just not enough staff. There's vacancies of over 150,000, probably more than that now. And you're not going to get people to move into care unless you properly reward it, because it's really poorly paid. So we are suggesting, we fought the general election on this, that there's a higher national minimum wage for care workers, £2 an hour more than the national living wage, so we can deal with those vacancies and really get the staff we need so we can look after people. And if you do that, and you can do that quite quickly, what it will mean is it will help the hospitals trying to discharge people, because without the staff, without the care home beds and the staff to go into people's homes to look after them and support the families, people get stuck in hospital. That's not good for them or their families, quite distressing, and it's very expensive. It's a huge waste of money. It's much cheaper to make sure the care is there in the community. So this is a reform that can't wait. And we're willing to sit round and have a cross-party talks on it. We said that again in our manifesto. So we want to be constructive on it, but we're absolutely clear. You cannot wait. You have to reform social care as an urgent measure. It is one of the reforms for the health service.
I know you're celebrating having all those new MPs and you're very pleased with how the general election campaign went, but you are facing a kind of a different era now, aren't you, where you have to kind of reinvent yourselves, in that you spent years fighting the Conservatives and now you're sitting with the Conservatives, or at least next to the Conservatives, on the opposition benches and facing a Labour government, which you might largely agree with. I mean, are you having a bit of a kind of identity crisis now as Liberal Democrats?
No, far from it. Listen, forget the other parties for a moment. I'm the leader of the Liberal Democrats, very proud of what we achieved with our record number of MPs. But our job now is to do now what we said we'd do at the election. You know, I've been around a little while. I've seen all political parties lose the trust of the public. We did too. And we've really worked at trying to rebuild that trust. By listening to people, making sure we knew what their top concerns were. And we fought the election on things like health and care and sewage and cost of living, because that's what people were worried about. And we came up with practical solutions. And having won a mandate, you know, the largest number of MPs we've had for over 100 years, our job now is to stick to that mandate and to fight for, yes, the constituencies that we now represent, for the health and care services and the environment in those areas. But also, if we're to go forward, by showing that we did what we said we would do at the election, hopefully we can then move on. And I think there are seats we can win from the Conservatives still. I talked about knocking down the blue wall, and we did a lot of that, but there's still more to go. And so I think we can really get some Conservative seats in the next election by showing how good Liberal Democrat MPs are, and that we have the same values of many Conservative voters and former Conservative voters. But we'll get back into the cities too. There's going to be a whole set of local elections in this Parliament, and I think our great cities need a strong Liberal presence, and some of them don't have that at the moment. So I'm determined we build that up, and so more people can have elected local Liberal Democrats representing them, fighting for their communities.
And so are you in this for another 4 or 5 years? Will you be leading the Liberal Democrats into the next election?
Oh, yes. You know, I think the excitement we've got and the opportunity we've got, the responsibility we've got is something I'm delighted about. And I'll let you into a little secret. I don't know if you remember our campaign, we had a bit of fun too. We had a few stunts. Some people didn't like them, but we thought they were good. But because we always had a serious message alongside it. So, you know, falling off the paddleboard, we talked about sewage. Coming down the slip and slide in 16Sept, we talked about children and young people's mental health. And the secret is this: we're planning the stunts for the next election already.
Theme parks and water parks across the United Kingdom will be very delighted that you're hanging around. Sir Ed Davey, we're looking at pictures of you on a jet ski right now. Thank you very much indeed. Joining us from the conference in Brighton.
Cheers.